My name is Nadine Blackwell. I'm a registered nurse, I'm a low vision therapist, I'm a school teacher, and I'm unemployed with no insurance. The first thing I would like to say is that after living outside of Philadelphia for many years, I was so glad to see that in the city of Philadelphia we had in place a really wonderful public health system. What has distressed me is how that system has been eroded through each administration that we've had come into office. The Philadelphia Public Health Centers were comprehensive health centers that provided comprehensive family care to all the residents of Philadelphia at no cost or reduced cost. There was a breakdown in the reduced cost system because you would go, but you would never get a bill, and then if you got a bill, no one knew where you were supposed to pay it. So I would like to see the health centers come back on the radar. We have nurses that are retiring and they're not being replaced. We've had nursing assistants and CMAs brought into the health center, but not nurses. What happens is that it overburdens the physicians. When you can have a nurse take care of a family of 5 for immunizations based on nurse practice, then that's 5 people that the doctor doesn't have to see because he doesn't need to see them. I would like to see in the city of Philadelphia, because they promised us when Philadelphia General Hospital was torn down, the other hospitals would step up to the podium, where they would step up to and take care of the residents of the city of Philadelphia. And the health centers had relationships with the various hospitals. Now, when we're young and strong and we're working, remember, we didn't care about people on welfare. But remember this, what affects one affects all, and now it's affecting us. So we're in a situation where we're being reactive, but we can always turn that around and be proactive. The other thing that I would ask is that I support Dr. Schwartz. I love the health centers. I went to college specifically to be a community health center, but it turned out that they felt I wasn't a good fit, but that's okay. I went to work on healthcare for the homeless and various other where I'm serving my community. But we need support for our health centers, and I don't mean vocal support. We need to get back to having 4 and 5 nurses on each team. We need to get back to having our specialists come into the health center. We need to get back to hiring people who are committed to public health. Okay, nepotism is all right. Hiring your friends is okay, but let's replace these people who are retiring. We have, at least to my knowledge, 3 women's health nurse practitioners that have gone out and not been replaced. So I say, let's rally around our Department of Health. Let's do it vocally, let's do it loud. We pay city wage tax, let it work for us.